Heart failure is common. More than 1 million people in the UK currently live with heart failure, and many more are at risk of developing it, such as people with conditions like diabetes and high blood pressure. It is the most common reason for older people to be admitted to hospital in the UK and has a poor prognosis, with 1 in 5 people dying within a year of diagnosis. With every heartbeat, the heart receives blood rich in oxygen from the lungs and pumps it around the body, supplying the organs and tissues with blood and oxygen. Heart failure occurs when the heart cannot pump blood effectively, causing back pressure and fluid accumulation in the lungs and legs. This can make people feel breathless, feel very tired, and can often lead to leg swelling. Not only is the heart required to squeeze effectively, but it also needs to relax effectively in order to allow it to fill up again with blood for the next heartbeat. Think of a garden water pump. It needs to squeeze water out, but it also needs to be able to draw it up again. Heart squeezing is termed systole, and heart relaxation is termed diastole. Problems with either process can lead to heart failure, and we therefore split these into 2 types, called systolic heart failure and diastolic heart failure. There is a 50-50 split in the number of patients that have each type. Diastolic heart failure is also called heart failure with preserved ejection fraction, or HFpEF for short, meaning that whilst the heart can squeeze the blood out, it doesn't relax properly when filling up with blood. Diastolic heart failure occurs when the heart becomes thickened and stiff. Heart relaxation can be thought of as stretching like an elastic band would. In diastolic heart failure, the heart becomes so stiff it makes it stretch more like a metal spring than a soft elastic band. When the heart becomes stiff, it increases the pressure in the circulatory system, leading to the back pressure and fluid congestion in the lungs and legs. Diastolic heart failure can be due to scar tissue forming around the heart cells, a process termed fibrosis. Myocardial fibrosis is when scar tissue forms in the heart, causing it to become stiff and rigid, eventually leading to diastolic heart failure. Despite extensive research already into diastolic heart failure, there are at present no treatments that have been shown to prolong life, unlike systolic heart failure, which has a number of treatments that do. Our research is investigating the use of an antifibrotic drug in patients with diastolic heart failure. By inhibiting the formation of fibrosis within the heart, we could reduce the amount of scar tissue and stiffness and allow the heart to relax normally again. Hopefully, this would not only improve patients' symptoms and their quality of life, but may also prolong life and reduce mortality. Our research trial is called the PIROUETTE Trial, being performed at the University Hospital of South Manchester in conjunction with the National Institute for Health Research. My name is Dr. Gavin Lewis, and I research into heart failure with Dr. Chris Miller at the University of Manchester.